Thank you. So yes, we analysed pre-diagnostic hormone therapy use and looking to see whether it was associated with survival from breast cancer. My data is taken from the California Teachers Study, which is a large study of over 100,000 women. They're all female teachers and school administrators, and all in California. The study was set up in 1995, and then we followed them through to the end of 2005, so that's 10 years of follow-up. And in that time, we had over 2,700 postmenopausal women were diagnosed with breast cancer. So this analysis is based on those 2,700 women. And their hormone use and the other risk factors that I use in the model were all reported by the women on a questionnaire that was sent in 1995. So one of our main finding really is that hormone therapy was related to survival. So the hormone therapy taken before the diagnosis improved survival. And that's a statistically significant finding. And this is just the basic percentages. So to show you that among the people that had never used hormone therapy before their diagnosis, 9% died. Whereas compared to the women that took estrogen and progestin, which is the combined form of hormone therapy, only 4% died. But of course, these numbers aren't adjusted for age or anything. So this is a model that does take into account age. So it's your risk of breast cancer or mortality for the hormone therapy users compared to the never users. And so there's the numbers on the right, the percentages give you the percentage reduction in risk. So for the estrogen alone users, it's a 36% reduction in risk associated with that estrogen use, and for the combined users it was a 63% reduction in risk. So why might hormone therapy improve survival? Well, there's two main sort of mechanisms that are postulated. There could be a biological effect of hormone therapy, and it is known, other people have found that hormone therapy users tend to have more favorable tumors, so they might be smaller, lower grade, less aggressive, and so on. And a lot of this might also be to do with that they're hormonally responsive. So as we all know, hormone therapy is known to cause breast cancer, but then it might also cause these tumors to be more sort of hormonally responsive. So you can take those hormones away, and that's kind of a form of treatment. Then you can also further treat with estrogen, estrogen-reducing therapy, and so they just make them easier tumors to treat in that way. So they tend to be more estrogen receptor positive. The other mechanism is that it could be just that the women that are taking hormone therapy are already healthier. So if you have a chronic long-term disease, the doctor might not even prescribe hormone therapy to start with. But also the fact that you're having a regular prescription filled, you're going to be in regular contact with your doctor, going to get all the mammographic screening. So that could be another reason. So we tried to adjust for all these different factors. So we took into account the health of the women before their diagnosis. And they were leaner, they were more healthy, they did more exercise, and they also did have better tumor types. So we took that into account. And after we'd done that, the women that had used estrogen alone, there was actually no difference with their survival compared to people who had no hormones before. However, the association with the combined therapy remained significant. So this is our basic conclusion, that estrogen-progestin before diagnosis improved survival by about 47%, whereas estrogen alone also improves survival, but not after we take into account the fact that the women are healthier and have better tumours.